So a client with respiratory distress. So we have John Davis, a 68-year-old male, presenting with difficulty breathing. Upon assessment, John is found to be dyspneic with shallow respirations. The question is, what is the first nursing action for John experiencing dyspnea? So this is one client, and we are being tested on the priority action that you will take. And the key phrase being a client experiencing dyspnea with shallow respiration. So A, remove pillows from under John's head. B, elevate the head of the bed. C, elevate the foot of the bed. D, take John's blood pressure. So drop your answer in the chat box. Which of these activities are we going to prioritize? Great, I got some answers already. B, Paminda, great. B for killers, that is great. Yes, we have to elevate the head of the bed. That will be our priority intervention for a patient experiencing dyspnea. Well done. So let's look at this case scenario. Michael Smith is a 55-year-old male with septic shock. He's receiving dopamine infusion in the ICU. During your assessment, the blood pressure is now 195, 120 millimeters of mercury. Which initial nursing action should be taken for Michael? A, discontinue the dopamine. B, notify physician. C, administer furosemide. D, assess Michael's Glasgow Coma scale. Which of these actions will be life-saving and should be prioritized? Nancy says B. Do we have any other question? Any answer? Kila says B. Any other answers? Okay, Shiva says A. Yes. Yes, Shiva got it correct. Yes, Mercy, A. Yes. You have to prioritize stopping it first before you go notify the physician. Because in this case, the dopamine is a vasopressor and it causes a significant increase in the blood pressure. So that is what you're supposed to know, that I have to stop it first. Why waste time to get notify the physician? Whilst the first life-saving action will be to stop it. So notifying the physician is important, no doubt. But the priority here is that we have to stop what is causing the rise in the blood pressure, which is the dopamine. So take note. So this question is also going to help us know how to assess and prioritize multiple patients. You remember I spoke to you about the need for us to be able to prioritize multiple patients. So let's look at these 4 clients that have been assigned to Nurse Brown. We have the first client, Amy, 27-year-old, admitted for an asthma flare-up and scheduled for discharge today. So see the key phrases in the question. Scheduled for discharge today. Kevin, 25-year-old, newly diagnosed with type 1 diabetes. Newly diagnosed. Mark Wilson, 38-year-old, newly admitted with an HB of 3.9 gram per deciliter. Linda, a 65-year-old with COPD, presents with ABG results. We have pH 7.25, CO2 66, bicarbonate 30. Which client should Sarah assess first? Amy, Kevin, Mark, or Linda? So kindly go through the question using the rules that I've taught you so far for prioritization and then the key phrases, the modifying phrases that would help you to prioritize well. So kindly drop your answer in the chat box. 27-year-old Amy, asthma flare, scheduled for discharge today. Remember that key phrase. Okay, a Jerusalem is choosing B. That is the newly diagnosed DM. So we have the newly diagnosed DM. We have Mark Wilson, 38-year-old, newly admitted. That is also a key phrase. And the hemoglobin is 3.9. 3.9. Very, very low. Critical. Okay, Sheba says, Linda Green, the client with COPD, presenting with the ABG result pH 7.25, CO2 66, bicarbonate 30. But remember, chronic obstructive pulmonary disease. So this client has an issue, but it is chronic. And then the fact that the client has COPD, you expect to have these ABG results. So it's an expected finding. So we are supposed to look at Kevin and Mark and choose between the two. C, yes. So yes, Sheba, well done. Well done, Nancy. Yes, is C. I hope you've understood it. We have newly admitted, we have newly diagnosed. But newly admitted, newly diagnosed with diabetes has to be prioritized, all right. But in this case scenario, we also have another key prioritization rule here. Newly admitted, but has a lab abnormality that is in a critical level. Critical level. So we have to work between these two, and then we have to prioritize Mark over Kelvin. Not that we're not going to see the newly diagnosed diabetes mellitus. That client could still be okay. But we're going to see this client who has a very, very low hemoglobin and needs urgent transfusion. I hope we got it. Yes, Danielle C. Great. Well done. Well done, everyone. So yes, the answer is C, the critical hemoglobin level, and requires immediate assessment and intervention. So always put yourself in that case scenario that you are that nurse on the ward. You went through the file. This client, okay, is a newly diagnosed diabetic. This one has HB, is a newly admitted, and is coming with an HB of 3.9. So in the practical sense, you are not going to run after the newly diagnosed type 1 diabetes. No, this one has a very low HB, and you have to make arrangement for transfusion. So always put yourself in the case scenario.